Right, we're going live on YouTube. Here we go. Now it's recorded. Hello and welcome everyone to episode 294 today. We're excited to have you. We're going to be talking about high blood pressure today, which is a very common thing that comes up in various discussions, questions that you guys have. And so this will be a good webinar. And I just want to make note here that Dr. Saunders is a phenomenal doctor, of course, but he is not your doctor. And so any of the things that we talk about today, we just would prefer that you discuss them with your doctor before you implement the things we talk about. All right. So adjust this a little bit here. Here we go. Okay. Everyone's hopping on. Say hello in the chat when you guys get here. We'd love to know who is here. If you have questions as we go along, will you post those in the Q&A? Oh, what did I do? Well, hopefully YouTube's still working. We'll see. Post those in the Q&A. If you're on YouTube, you can post those in the comments. We'd love to hear from you. Gosh, I hope YouTube is working. It's saying that it's not. I'm going to get out of it. Maybe I have too many things open, you know? Sometimes that happens. Think it'll be working. All right, we have Christine here, Ricardo, hello. Teresa from Oregon, hello. Welcome. Martha is here. We're excited to have you guys here. Welcome, welcome. Let's go ahead and get started here today. So, high blood pressure. What does that actually mean, Dr. Saunders? I mean, if you think about it, high blood pressure, that means there's too much pressure going through with your blood going through your veins. That's what it seems like it should mean. Is that true?
Actually, yes. Yeah, your
Okay.
pressure is high. And so there is a real thing that is high blood pressure. So think about it in terms of if you have pressure in a hose, for example, you have your garden hose. And we used to have this old garden hose. It was not reinforced. It was just like a rubber hose, right? Or a plastic hose. And so we had a sprayer on it, and when you stop the sprayer, it plugs it up, and then the pressure builds up in it. And this hose would like get bigger and bigger and bigger, and eventually it would burst. And then my dad would have to cut off the burst part and splice it together with the little hose splicer thing. And then the hose was getting shorter, shorter, shorter. In the old days, you fixed things instead of just buying a new hose, right? It was way different. So when I was a kid, and we would take the hose and we would also shove it into the ground. You'd turn it on and it would go into the ground. But then it wouldn't come back out. So my dad would go, "You guys," and he'd cut off the hose and put another end on it. Anyway, so we think of our blood vessels as like hoses like this, and there's a certain amount of pressure that they can stand. And so high blood pressure is like your pressure is too high for your blood vessels. And that's what we're told, and that's kind of what we think, that it's going to be like that hose, that like we're building up so much pressure it's going to blow up and balloon out and then pop and create an aneurysm, and that's how people get strokes, for example, one type of stroke. Or how people die when they get an aortic aneurysm. The aorta is the big, 3 centimeter hose that's going down right through from the chest down through the abdomen. And it can balloon out and get big and pop. I've seen people when I was in residency in the hospital, and they're already there in the hospital, and their aortic aneurysm ruptures and they die. There's just like, what do? You can't get to it fast enough. So that's what, people worry about, that kind of stuff. Now, does high blood pressure cause that? That's a big question. And the answer is no. It's really different. Things are different than we're told that they are. So let's look at high blood pressure in terms of how much pressure is actually in these arteries. When you have normal blood pressure, you're talking about three. So 120 millimeters of mercury, millimeters of mercury is the way they used to measure it, and centimeters of water, which is roughly equivalent. So that's the way the old sphygmomanometers worked, is with mercury, like a mercury thermometer, but this was with pressure. And the pressure was how many millimeters of mercury would it push up. If you translate that into pounds per square inch, it's actually very little. 120 pounds per square inch, or 120 millimeters of mercury is about 3 pounds per square inch. And when you get to 200, it's like 4.5 pounds per square inch. And so if you think about what 3 pounds is per square inch, and then inside your blood vessels, your little teeny blood vessels, it takes a lot of blood vessel to make 1 square inch. And so there's 4 pounds divided up into this whole long thing. You are not creating so much pressure that you can pop your blood vessels. What doctors do, what happens every day with what we call coronary artery bypass graft, or CABG, that's the bypass surgery. They take veins, thin-walled veins, out of your legs and put them in the arteries of your heart, where this high pressure is, high pressure. Well, veins have like 1 pound per square inch or less than 1 pound per square inch. And so there's very little pressure in the veins. And yet they take these veins out, replace an artery with a vein, and they never pop. They're fine. And so they can take the pressure. The pressure is not that much pressure. And so people go, they get this idea, 200 over 100, oh my gosh, you better go to the ER. You're going to get a stroke any minute. And it's just not a thing. It's not real. That is so ignorant and misguided. That's not the way things work at all. Now, if you have an aneurysm, you could have those. Some people do, and they do pop. But those are people who have a problem with connective tissue. They have a connective tissue disorder, or they have a congenital defect in the blood vessel that gives it an aneurysm because it's missing part of the wall that gives it strength. So yeah, these things happen. Aneurysms happen. People who have connective tissue disorders, it's fairly common. It happens. And so the point of high blood pressure is the question of, why is it high? So it's not the pressure itself that's the problem. What is causing the pressure? That's the problem. So we focus so much on the pressure itself that we don't deal with the problem. And we do this with diabetes too, focusing so much on the sugar itself instead of dealing with, why is that blood sugar going up in the first place? We use the idea of the sink overflowing, and nobody thinks to turn off the water. They're just mopping up the floor, that kind of thing. Well, blood pressure is kind of the same way. You're dealing with the blood pressure. You're just mopping up the floor. That's what drugs do. But they don't deal with the problem of, why is the blood pressure high? So why does the blood pressure get high? And that's what you need to know. So when you go to a doctor and your blood pressure is high, they automatically call it primary hypertension. Primary means it has no cause. It causes itself. That's just what it is. There's no underlying cause. Well, actually, in reality, that doesn't exist. There is no such thing as primary hypertension. It's always secondary. Hypertension is always secondary to something else. So there's over 100 different reasons why your blood pressure could be going up. It could be a problem with your adrenal glands. It could be a pituitary hormone problem. It could be other hormone abnormalities. It could be a kidney problem. It could be a heart problem. It could be a liver problem. It could be metabolic problem. People get high blood pressure because they have insulin resistance, for example, causes high blood pressure. Inflammation of any kind can cause high blood pressure. If your brain isn't getting enough circulation, your brain will send a signal saying to the heart, saying, hey, let's up the blood pressure a little bit so I can get more circulation up here. And so the blood pressure goes up so that your brain can get more. And you know, there are a lot of people walking around, and these studies have been done, like young women age 20 already have a decreased blood flow to their brain, and their energy systems are not working in their brain. So their brain is saying, hey, you know, raise the pressure. We need some more energy here. And so the blood pressure is going up because the brain's not getting enough energy. It's not a blood flow problem, but that's the brain's only way of getting more. The brain says, I need more oxygen, raise the blood pressure, but it's not an oxygen problem. But the brain can't ferret out the different kinds of problems. If it's not making enough energy, the assumption is, I'm not getting enough oxygen, so raise the blood pressure. So for all of the 100 different reasons why you have secondary hypertension. So if you've ever been diagnosed with primary hypertension, don't accept that. That's not real. It's fake. So you want a real diagnosis, you go back to your doctor and you say, why is my blood pressure high? And then you have a bunch of tests. You test your kidneys, you test your adrenal glands, you test your hormones, you test your liver, and you look for the underlying cause of why it's happening. And then deal with the cause. Because if you deal with the cause, then you're not going to get problems. So, for example, I had somebody who had hypertension for years, was put on medication, 3 medications, blood pressure was still elevated. It wasn't normal. It was still elevated on 3 medications. So so we started doing tests, and we found out that her kidney was the problem. So we did some further testing and found out that the artery going to her kidney was really tortuous. It was, and so one of her kidneys was not getting a good blood flow. And so that kidney was putting out something called renin, saying, hey, raise the blood pressure. I need more blood flow here. And so all they had to do was put a stent in. They put a tube, a plastic tube in the artery. Not plastic. I don't know. Anyway, they put a stent in the artery to open it up. And then that kidney was getting enough blood flow, and the kidney goes, oh, yeah, we're good. Okay, good job. Now I've got enough blood flow. And the blood pressure went down to normal and on 0 medications. So that's what you're looking for. Why? Why is this happening? I had another person with high blood pressure, and his blood pressure was super high. So he's put on a bunch of medications. Blood pressure is not coming down. And in the meantime, he's on all these blood pressure medications, and then he gets admitted to a psych ward in a hospital twice, and his wife leaves him, and he's like, he's not sleeping all night, he's freaking out, his blood pressure's really high, and the doctors are saying, you know, he's psycho and everything. Well, it turned out he had a pituitary tumor that was causing his adrenals to go up, and when your adrenals are high, that's the wake up hormone, right? So he's not sleeping, and he's walking around saying, I'm Jesus, I'm here to save the world. And literally that's what he was saying, and that's why his wife is like, I'm out of here. So they took the pituitary tumor out of his brain, and he was like perfectly normal guy, no high blood pressure. It was no longer delusional. He was sleeping at night. Everything just came back to normal when they fixed the problem. So that's the kind of thing that you're looking for. It's okay. The pressure is a sign of something, and then of what? Is it because I have type 2 diabetes? That makes the blood pressure go up. Okay, so I have high blood sugar, high insulin, high blood pressure. I've gained a lot of weight around the middle. Hey, I have a metabolic syndrome. And that's a metabolic problem. So you fix the metabolic problem and the blood pressure just comes down to normal. You never needed medication in the first place because the blood pressure is secondary. It's always secondary. So find the cause and fix it. There's 100 different causes, and that's what doctors are for. Is the purpose for the doctor is not just to throw a drug at you, it is to find out why. That's what a diagnosis is.
Interesting. Do you suppose many people, when they are diagnosed with high blood pressure, is it even offered? Do most doctors even tell them why? Or is it just take the medications?
Well, okay. Think of it this way. If you're confronted with hundreds of possible causes, there's what wrongdiagnosis.com says there's 300 different reasons why your blood pressure could be high.
Wow.
So think of that. So hundreds of possible causes, and you just go, you know what? This is too complicated to try and figure out why your blood pressure is high. Just take the pill. It's like a lot simpler, and I can get you out of my office in 5 minutes instead of it can take a long time to try and figure out why people's blood pressure is high. So it's just faster and easier to give a medication, and so that's why it's done.
Interesting. Okay, of the 45 people that responded to my poll, just asking if they take blood pressure medications currently, uh, 24 out of the 45 do take blood pressure medications. And
Wow,
yeah,
that's about half. That's over half, just over half.
54% of the respondents. I would also be curious too, and we'll save this for another topic, but I wonder how many of them also take high cholesterol medications, because I do find that it seems like that happens a lot too. A lot of people that I talk to are taking both. So I don't know
Yeah.
why that is, but that'll be a topic for another day. Okay, so let's say you are taking high blood pressure medication, then you don't necessarily know what the cause is. You say, go to your doctor and ask them why I have high blood pressure, right? That's kind of our next step.
Yeah. So that is the question. Why is my blood pressure high?
Okay,
And then start doing research on that. What are all
right.
the possible reasons why? And then start ferreting those out. And it starts with uh, a discussion of what kinds of things you're dealing with. So if you're under a whole lot of stress, then that's one thing. If you're having mental fogginess and brain fog and issues thinking and remembering things, well, okay, that leads you in that direction. If you're getting palpitations of your heart and panic attacks, then that leans you in that direction. If you've had some tests and your kidney function is low, then that leads you in that direction. So there are ways of narrowing down the scope from whatever 100, 300 different things to, okay, it's more likely in this area, so we'll test for that.
Okay. Yeah, I know Christine had asked, can a primary care doc order the tests that we need to uncover the cause? And you have a list of tests that we should ask for, and really it's probably case by case basis.
Case by case, and that's the thing, because there's so many possible causes. It's important that you find that the one for you. You just don't do a shotgun on every possible cause. Everybody in the world isn't going to get a ultrasound of their renal artery, or a renal artery angiogram or something. But some people are going to need that, and first you test for it. So you have to kind of narrow it down first by what are the symptoms, what kinds of things are you dealing with. And so if it's like type 2 diabetes, okay, we're looking for a metabolic problem. That's probably what's going on. So that kind of thing. And so you can narrow down the focus and make it easier.
Okay, we also had a question from Whitney. What is high blood pressure versus normal blood pressure? And is it the same for everyone?
Yeah, that's a really good question. No, it's not the same for everyone, but it is, in a sense, the same for everyone. So everyone with normal arteries and normal function should have an optimum blood pressure somewhere between 120 and 140 on the high side, or let's say 110 and 140 on the high side on the systolic blood pressure. And on the diastolic blood pressure, right around 75. So like between 70 and 80 is clearly an optimum blood pressure. If you drop below that, then the death rate seems to rise. If you go above that, the death rate seems to rise. So the diastolic is actually more indicative of problems than the systolic. The systolic blood pressure, the higher number, is more indicative of vascular issues. So if you have just tense vascular, your blood vessels are tense, your arteries are not very compliant, whether that's from hardening of the arteries or just stiffness of the arteries, then you're going to have high systolic, but you still have the normal diastolic, and it's actually okay. As we age, we tend to get more stiffness in the arteries. So we need a higher blood pressure. And actually, there's some research to show that if you drop the blood pressure below 140 in a 70 to 80-year-old, the death rate goes up. So you want it around 140. And not around the 120 range. Like younger people should have it around the 120 range. So it's not the same for everyone, but pretty much the diastolic stays the same for everyone. That's the lower number should be right around 75. Between 70 and 80 is clearly optimal. But normal would be much wider than that, between 60 and 90. Not much wider, but yeah.
I had asked, can menopause or postmenopause contribute to high blood pressure as well?
Absolutely. Okay, good question. See, I said hormones are one of
Yeah.
on that list, right? So secondary causes of hypertension include if you lose progesterone, progesterone has a relaxing effect on arteries. And that's why like pregnant women get 100 times more progesterone than they would normally have when women aren't pregnant. So their blood vessels dilate. They get 1.5 times their blood volume because their blood vessels are dilated. They get varicose veins. The veins are all dilated. They have all this progesterone just relaxing all their veins, and they have poor circulation, not poor necessarily, but they have to deal more with, like, when you stand up, you get dizzy, you have to hold on to something, that kind of thing, because of all that progesterone. So that's all the relaxing. It drops the blood pressure. Women, premenopausal women, have lower blood pressure than men as a rule, and a lot of that is progesterone. And then what happens during postmenopause? The women have like just as much heart attack and other problems as men at that point because of that loss of progesterone primarily. And so, yeah, absolutely. So the change in hormones does make a difference.
Okay. Sib also, or no, it wasn't Sib. Where did I see this question? Oh, Mary had said if high blood pressure does not cause an aneurysm, then what are the dangers of high blood pressure? I thought it could cause a stroke by bursting a vessel in the brain.
There are people who get a burst vessel in the brain, and they, because of an aneurysm in the brain, it's not because of the high blood pressure. It's because of the pressure the defect in the wall of the artery. Okay, so yes, that happens, but by far the large majority of strokes are clots. And so it's not a blood vessel burst in the brain. That happens from thin-walled veins or thin-walled arteries. You don't have to have high blood pressure to get an aneurysm. I had a young woman when I was in residency. It was a tragic thing. She burst an aneurysm in her brain. She was saved from death. She didn't die, but she did lose most of the function on her right side. But but she never had high blood pressure. It's not high blood pressure that causes aneurysms. It's you have an aneurysm, and any pressure can balloon out. Now, if you have like an aortic aneurysm and you have high blood pressure and you have an aortic aneurysm, that could make it worse than if you had normal blood pressure. Of course, that could be an issue too. So if you have connective tissue problems, then that's another good reason to keep your blood pressure down. But that's not the problem with like strokes, as you mentioned. It's clotting. And so if you're forming clots in your arteries, that's where you get the problems of, uh, of strokes, for example. So your question then was, does blood pressure, high blood pressure, damage arteries? And there is some evidence, yes, it does, but that's not the cause. That's a partial, that's only looking at one of the symptoms. Really what you need to look at is, why is the blood pressure elevated? Because if you have a metabolic problem, well, then that's a reason for causing clots and damage to the arteries. If you have a kidney problem and your hormones are out of balance, you have a tumor, that's a reason for causing clots. So getting damage to the arteries is, the blood pressure is part of the picture, but it's only part of the picture. You don't decrease, there's several studies that show you don't decrease your risk of stroke by dropping the blood pressure just with medications. You have to deal with the cause, the underlying reason for it, and then you get a drop in stroke rates.
My internet is kind of cutting out, it looks like. So if I disappear, I should be coming back. If you guys can post your questions over in the Q&A, that would be really helpful. And okay, I'm going to keep asking some here. Sue says my diastolic pressure is often in the 60s. I'm 74 years old. My blood pressure is generally in the normal range.
Good work. Okay. Well, in the 60s is fine. So, like I said, anywhere from the 60s to the 80s is normal, and that optimal place being 75.
Okay. Manja said I have low blood pressure, but high cholesterol, and I'm taking the omega-3 supplements per your recommendation. Any concerns? Thank you.
Um, yeah, there's variability in that low blood pressure. So your blood pressure can be pretty low when it's measured on your body. But if you're not getting symptoms, if you're not getting dizziness when you stand up, or lightheadedness, or palpitations of your heart, or any signs of hypotension, low blood pressure, then your pressure's okay. Because the pressure changes minute to minute, and if you're sitting down or laying down and you're relaxed, and you take your blood pressure and it's 100 over 50, technically that's low. Well, as soon as you stand up, it's going to be 120 over 80 or something. And if not, and you're getting dizziness, then there's a problem. And yes, you have to deal with that.
I'm going to bump up to some of these other questions that maybe are outside of blood pressure discussion. But Lily had said, is flaxseed oil in the same category as other bad seed oils? And isn't it processed in a better way? For example, Barlean's flax oil with lignans.
Okay. So, yeah, flaxseed oil is much. Okay. So the answer to the question is no. It's not like other seed oils. There are two seed oils that are actually really good sources of omega-3, flax and chia. There are other sources of omega-3, but they also have omega-6. And so those are really the two that have high omega-3, low omega-6. And the only issue with the oil is that it's a polyunsaturated fat that can oxidize and create trans fats. So you have to be careful that it's not oxidized. So you keep it in the refrigerator, and the Barleans, they put vitamin E in it, and the vitamin E protects it somewhat from getting oxidized. The best way to get flaxseed oil is eating flax seeds. And if you take flax seeds and grind up the flax seeds and put it in your smoothie or whatever, then it's fresh and not oxidized that way.
I remember many years ago, I wish Joe was on here. Maybe you were there too, but he had had that Barlean's flax seed oil. I'm pretty sure. Could have been an Omega, I'm not sure. But it was an orange flavor and it was so good. I'll never forget it. It was like orange dreamsicle. I don't know how that could have been healthy for you. Had to put a lot of sugar in there. But I remember I had it and it was really good. Actually, I bet that was 15 years ago. It's been a long time. Okay, random thing for the day. Okay, Tom says I purchased Cinechroma, berberine, and the citrus bergamot. What is the best way to best way to take the three each day? Should I start on berberine slowly because of the possible side effects?
Um, well, slowly, I suppose. If you take like one of each with a morning meal, it's best processed in the morning. So that would be good. The berberine, you could just, yeah, I often tell people, don't start a whole bunch of things at once, because if you have some reaction that you don't know what you reacted to. Um, so take one and see how you feel, and then add in another one and see how you feel, and then add in another one, and make sure you don't have a problem. I've had somebody recently figure out that zinc was his problem. I took a handful of supplements, and he goes, yeah, but they irritate my stomach, and so I had him go one by one, and it was the zinc that was causing his stomach irritation. So he took all the other ones without zinc, and he was just fine. And then we got him another form of zinc, and so not doing them all at the same time is a good idea. But the Cinechroma is just one a day in the morning, and try that. And the berberine ideally is one 3 times a day, to lower blood sugar and to help with insulin resistance.
All right. William says the 30-day detox program states that it's a 20-gram carb diabetic diet. Is that 20 grams per day or a meal?
Per day. It's 20 grams a day.
Net carbs, we'll throw that in there. It's net carbs. So you can subtract your fiber from that. So you're getting a little bit more food than you think.
Yeah.
All
Yeah.
right. Good question, though. And you can do it. Many have on this show here today. So you can do it. All right. So let's see here. Already answered that question. Oh, that's strange. Okay. Whitney had said, what about people who have consistently low blood pressure? We touched on that a little bit, maybe.
Yeah. So as long as you're not getting signs of low blood pressure like dizziness, lightheadedness, passing out, palpitations of your heart, those kinds of things, then your blood pressure can be measured low while you're sitting and quiet and relaxed, but it's going to go up when you need more circulation, assuming your sympathetic nervous system is working properly.
Yeah. Okay. Hi Joe, says, is stress moderation recommended for high blood pressure? And if so, are there any good supplements to help relax?
Okay. Again, there are so many different causes of high blood pressure, and stress is one of them. And there's so much around stress. There's distress, which is a problem stress, and there's eustress, which is a good kind of stress. So if I'm in a trauma, like I fall off a roof and hit the ground and break some bones, that's distress. Whereas if I'm out running and making little microfractures in my bones because I'm pounding the pavement, That's eustress. That means that's good stress. That's going to rebuild and repair my body, whereas the other one is bad. So um, the distress, if your blood pressure is high because of distress of whatever kind, you're in pain all the time. Loneliness is a big deal for high blood pressure, and it is. I don't know if anybody would be surprised at this, but it's really big when researchers want to stress out an animal. They isolate them. When hardened criminals in prison, when they want to punish them, they isolate them. Isolation is actually really bad for that kind of stress. So dealing with stress is so individual. Why are you distressed? And sometimes creating stress, like eustress, like going out for a run, will lower blood pressure. My son told me that recently. He's like, oh man, I'm having panic attacks and I've been taking Valium and all of this stuff. And he said, I just went out for a run and I was like, wow, I'm good and didn't need any medications or anything and was able to function all day long. So, it's so individual that yes, you have to find out where the distress is and then repair it in whatever way you can.
Okay, Martha said I had stents in my heart. Doctor automatically put me on high blood pressure. My blood pressure is usually 120 over 65. Do I need to take meds?
Ah, I don't think I would put anybody at 120 over 65. Um, I don't know how old you are, but if you've had stents in your heart, it means you probably have significant atherosclerosis, which means you're going to probably need the higher pressure to get the circulation to the rest of your body, and especially your brain. So I think that I think that you should like be very careful, work with your doctor on that about getting your blood pressure to a point where you have good circulation.
All right. Michelle had said, why do we have stomach pain sometimes with bowel movements?
Stomach pains with bowel, it depends. Sometimes it's due to gas, sometimes it's due to spasms. Um, the muscle spasms that are created to produce a bowel movement can be painful. Sometimes it's because there's a problem inside, like diverticulitis or something like that, that is not manifest until there's some pressure, like when you're having a bowel movement. Yeah, I think finding out why, again, that's the important part. If you don't know why the pain is there, find out why. And that may mean you have some imaging, like a CT scan to look for diverticulitis or impingement or tumors or something like that. Um, Sometimes it's a vascular problem, and you may have to have some blood vessel studies or something.
Lakshmi says I had cortisone shot for knee pain. Dr. Rabidi said that it would temporarily spike blood sugar, and I should wear a continuous glucose monitor. I believe is what it says CMG. What do you suggest?
Um, I think it's fun to have a CGM. I would totally do that. You get to see it, and yes, you get a shot of cortisone. It's going to raise your blood sugar because it causes insulin resistance. And so if you already have insulin resistance and you're adding on top of the insulin resistance, then you're just going to have higher blood sugar. And the CGM can show you. I had somebody yesterday with a CGM that I was talking to, and he said, oh my gosh, he said, sandwiches make my blood sugar go up like crazy. We did his study. We were going through his labs, And we found out that his pancreas doesn't put out very much insulin. That he has just little bit of insulin, very low insulin level. So if he eats anything with sugar, starch, it goes up dramatically. And so since the cortisone makes you more insulin resistant, it would be really good to know, what is it that spikes my blood sugar?
Okay. Sib said, we've been having extremely high temperatures here in Florida. Can the high temperatures affect your blood sugar if you spend extended time in the heat?
Hmm. Well, by itself, no, but secondarily, if you're stressed, you're dehydrated, then your blood sugar can go up because of that, because of making insulin resistance, the same way if someone has like a cortisone injection. If your cortisol is up because of stress, from the stress from being hot, I don't know, dilated blood vessels, relative dehydration. Yeah, so no, but as far as like directly influencing blood sugar, only if you're drinking sweet tea.
Okay, good question here from Mary. Mary said, I'm still not understanding. If high blood pressure is danger, is simply the cause of the high blood pressure, and the cause is not pursued by most physicians, then why would there be a risk in discontinuing medication for high blood pressure? I think he wants to talk you to talk to your doctor because he doesn't want to give you medical advice about stopping that medication, if I had to guess.
Yeah. Okay. So, um, so doctors work on a level of fear. And so there's four different motivations that people have. So when I'm doing what I want to do, then I don't need motivation. I do what I want to do. If I'm laying in bed and that's what I want to do, then I don't need motivation to lay in bed. If I love my work and I'm so excited to go to work, I don't need motivation to do that. That's something I want to do. So we only need motivation to do things we don't want to do. And so there's levels of motivating people. And you start out with like a little child. Children, you use something called fear. That's the lowest level of motivation. If you do that, you're going to get spanked. You're going to get isolated. You're going to get a timeout. Whatever it is, that fear it motivates the child to go, I'm not going to take the cookie out of the cookie jar because I might get in trouble. That's fear. And then the next level up would be reward. So if you do this thing that you don't want to do, you'll get a big reward. That's why people go to work. I not me, but some people, they go to work every day so that they can to get money. And they go, yeah, I wish I didn't have to be here. I'd rather be at the beach. But I need the money, so I'm going to be here. So they're there for a reward. And that's the second level of motivation. The third is commitment. When somebody, just because I said I'm going to do it, so I'm going to do it. And that's why people stay married for years. And that's why people take care of their children, and they don't want to take care of their children, but they have a commitment, so they're going to do it. And then the highest level is love. And love is extending yourself for the benefit of others. And I'm going to do this because I love it, because I love you, because of love. And so those are the motivations. So doctors always work on the lowest motivation. You never see a doctor go and go, because I love you, I'm giving you this drug. They always say, if you don't take this drug, you're going to die. So that's the thing about the thing about blood pressure medication is, most doctors really believe it. They actually believe that if you don't take this medication, you're going to die. And they also say, we don't need to know what the cause is, but if you don't know what the cause is, you don't know why it's happening. You don't know what to do about it.
Yeah. Yeah, that's good. Okay. Really good question here from Whitney. Dr. Saunders and I were just having this discussion before the webinar started. But Whitney says, how can you tell if you're stressed? I've never felt stress, so what should I be looking out for?
How can you tell if you're stressed? Okay. Um, that's a good question. And a lot of people feel that way. They go, no, I'm fine. And a lot of people say, I'm fine. And they come in and I'll do some blood tests on them. And I'm like, oh my gosh, your cortisol is really elevated. You have insulin resistance. Man, you must be really stressed. No, no, I'm fine. Everything's okay. And I actually have a patient right now in that situation. He's gaining weight. He can't walk anymore. I'm like, okay, what's going on? No, I'm fine. Everything's okay. But his family tells us otherwise. So people on the outside can often see what we're not seeing on the inside. So accepting, um, yeah, how do you know if you're stressed? I don't know. I think, yeah, somehow you got to figure it out.
Yeah, and I was sharing with Dr. Saunders, mine typically will manifest in my body. Like what he was saying, all of a sudden I'll be like, oh, I don't feel that well, or this part of my body is hurting. Or, and a lot of times for me, if it's emotional things, that seems to correlate with my gut health quite a bit. There's just different things that happen. And so that's how it is for me. I don't know if you guys have other recommendations or thoughts or ideas about that, post that in the chat. It'd be good for us all to learn a little bit. Cynthia said my dad has been on the Nurbala for about a week and a half now, and he said that his legs are feeling better with the neuropathy and he's having less pain when walking. He said, thank you.
Wow, great, great. I've had people call me with Nervala. I've had several people recently tell me how much better they are. One of them was he called me. He was actually complaining. He said, "So I'm getting this like tingling and burning in my feet now," and I'm like, "Good, your nerves are getting better." And he goes, "Oh, is that what that is?" Yeah, because they were numb before and now they're not numb. He actually has some feelings. That means the feelings coming back. That's a good sign. And he's like, "Oh, okay, fine."
Okay. Brenda said, what can I do to help my pancreas increase insulin production?
Okay, good question. That is $1 million question, and it's not easy. So finding out why it's not producing is one thing, but that's not always easy. So there's an example of rats that had diabetes where they put an injection called substance P on the vagus nerve to block. They put a nerve block um, to the pancreas so that vagus nerve could not reach, so the brain couldn't contact the pancreas and the pancreas couldn't contact the brain, so that there was no, they cut off communication between the brain and the pancreas. And all of a sudden, boom, the pancreas started working just fine. There's sometimes a block there. And so getting the parasympathetic nervous system, the vagus nerve working it may be one way of doing that. And something you could do is called the Wim Hof method. Wim, WIMHOF. Wim Hof method is, if you look it up online, it's wimhofmethod.com. And he guides people through how to balance their autonomic nervous system between the sympathetic and the parasympathetic. And that's kind of important. I had two calls this morning, like one right after the other. One was a woman, older woman, who was having palpitations of her heart. What else? Anyway, it was all sympathetic nervous stimulation. And then the other was a young girl going back to school and being really nervous about it and having all this sympathetic nervous stimulation. And I told them both the same thing. Hey, do the Wim Hof breathing. Just do that parasympathetic abdominal breathing. So your diaphragmatic breathing. And that really brings in the parasympathetics to balance it. What does that have to do with diabetes? Well, I would just say, if you have a parasympathetic, then things digest better and the pancreas may work better. Otherwise, if you have like autoimmune disease, then you have to do something like an autoimmune protocol. And so you may have to look to see if you have antibodies that are antibodies against the islet cells or antibodies against insulin to see if that's the issue.
Okay. Frank and Pat said, as the A1C fasting glucose peptide came down, the blood pressure normalized on the phase 1. Post-stroke, off all medication. Thank you, Dr. Saunders and team.
Wow, good work. Good work.
All right. Let me see here. Um, Lily said, what behaviors in patients might alert their doctor that they may be heading toward having a stroke?
Huh. Behaviors? Well, headaches. I don't know. Behaviors. Okay, so if someone is like all of a sudden having headaches and they never used to get headaches, that would be something to consider. Clotting, if there's any reason for clotting, if you have clots forming in other areas of your body, you could be heading for a stroke. People that have atrial fibrillation can form clots in their heart that can break off and go up and cause a stroke in the brain. So finding out if there's any clotting problems, inflammatory problems, chronic inflammation, um, things like headaches, because people that get like mini strokes, those are harbinger of a bigger stroke to come if they don't take care of it. So things like that too. But so any neurological symptoms would be a possibility as well.
Okay. I'm going to post this actually in the comments because I know we're running out of time. Someone had said, why is my fasting glucose higher in the morning when I check it before bedtime? It's under 100. And guess what? This is in our list of top 10 most asked questions. You'll find it at bartonwebinar.com, but I'm going to post the link to the answer to that. So that'll take you to our YouTube channel. Make sure you subscribe there so you're always notified whenever we upload a new video, okay? So check the chat, click that link, and you're going to get your answer. Okay. Janet said, what would be causing my blood sugar to rise at 10 a.m., 2 p.m., and 8 p.m., whether I eat or not? This is almost every day.
Hmm. Gosh. Well, okay. So what else causes the blood sugar to rise? And that would be something like when your cortisol goes up, when there's like in the morning, we call it the dawn effect. The cortisol goes up, makes you insulin resistant. You start making blood sugar. Your liver starts making glucose, so you raise your glucose. There are so many factors involved in what's going on with blood sugar that it's not a one-to-one like I eat it. It happens, well, it does when you're insulin resistant and you have a continuous glucose monitor and you're looking at it and you're going, gosh, like that guy, if I eat a sandwich, poof, well, like my blood sugar shoots up. So sometimes it's really obvious, but there's a lot of other factors at play. Your liver is making glucose when you don't eat. And if you have some insulin resistance from like cortisol going up, then that's going to make your blood sugar shoot up, even though you haven't eaten anything at all. So that's possible.
All right. Oh, there was another question I wanted to mention in here really quick. Diane had just said that, she's been working with a coach. Do you have a committed coach, Diane? Let us know that. She's working with a coach. Her doctor wanted her to start medication. She said, I don't want to. That's the overview of that story, but I'd be curious to know if you have a committed coach. She does. Great, Diane. Let us know who it is. I'd be curious. Keep working hard. That is awesome. Juliana said, do the doctors get a bonus from the insurance company to give out the medications to patients for high blood pressure? and diabetes, and the medication does not help the situation. I don't know if they get it from the insurance company, but I bet they get something from the pharmaceutical companies.
Oh, not so much anymore.
Oh, they don't.
Really, it's more of the doctors are working on the fear level too. The motivation is there's protocols, and you have to follow the protocol. If you follow the protocol, you're safe. So every doctor is safe by following the protocol. So that's why you go, no matter where you go in the United States, you get the same stuff. And you don't have anything different in any location or any doctor or whatever, because everybody has the same protocols that are put out by the drug companies. And as long as you do that, you're safe from they won't take your license away. You can't get sued. Lawsuits, everything. You're safe as long as you do the protocol that everybody else does.
Yeah, Diane had said same in Canada. I was going to say that's kind of what it feels like. Yep. All right, that is it for today, everyone. Great webinar, Dr. Saunders. Thank you so much. We'll see
Thank
you
you.
next week.
Okay.
Bye-bye.
Bye.
All of you, come back next week and tell a friend. They can find more information at bartonwebinar.com. Also, if you're interested in any of the supplements or products, use code webinar25. That's one word, webinar25, and you're going to save 25%. All right. We'll see you soon.